In the 1950s, one man's hypothesis changed the course of nutrition science for decades. His name, Ancel Keys, a psychologist who gave dietary fat a bad name and inadvertently sparked a health crisis that we're still grappling with today. But here's the kicker. This isn't breaking news. The information about Keys' flawed research has been spreading on the internet from a while now, and we are witnessing a paradigm shift in nutrition science, and people are hungry for the truth. Keys hypothesized that dietary fat, especially saturated fat, was the primary culprit behind heart disease. His infamous 7-country study seemed to prove it. But there was a problem. Keys cherry-picked his data, ignoring countries that didn't fit his hypothesis. Despite its flaws, this study became the foundation of dietary guidelines for decades. The food pyramid we all grew up with, that was a direct result of Keys' work. But here's the plot twist. That pyramid is now turning upside down. Why? Because we've learned that dietary fat doesn't necessarily convert into bad fat. It's actually excess carbohydrates that are the main culprit. When we eat more carbs than our body needs for energy, the excess is converted to fat for storage. It's a process called de novo lipogenesis, and it's at the heart of our obesity epidemic. This is why we are seeing a resurgence of high-fat, low-carb diets like keto. These diets flip the script, turning your body into a fat-burning machine instead of sugar-burning one. It's what keto enthusiasts call being fat-adapted, or in a state of nutritional ketosis. But it's not just about weight loss. We're talking about a complete overhaul of our understanding of metabolic health. Terms like insulin resistance, glycemic index, and inflammation are becoming part of our everyday conversation. Remember when we were told to eat 6 small meals a day to stroke that metabolic fire? That advice is now being challenged by the concept of intermittent fasting, which gives your body a break from constant insulin spikes. The nutrition world is experiencing what Thomas Kuhn would call a paradigm shift. Old dogmas are being questioned and new evidence is emerging. It's like we're rewriting the operating system of human nutrition. So what should we make of all this information flooding our social media feeds? It's easy to feel overwhelmed by the clutter of debates and conflicting advice about what to eat and what to avoid. But don't get frustrated or give up. Instead, understand that what we are witnessing is a correction of misinformation. Remember, science is self-correcting. As our methods become more advanced, our understanding deepens. We're developing better markers and reducing biases. Soon the dust will settle. In the meanwhile, whether you are a committed vegetarian, a devoted vegan, a strict carnivore, or a flexible pescatarian, focus on this overarching principle. Prioritize natural, organic foods free from adulteration and ultra-processing. Your body is unique and your dietary choices should reflect that. Stay curious, stay informed, but most importantly, listen to your body. The path to health isn't about following trends. It's about finding what works best for you in the long run.